Right. You get a video for I get that. Take pictures.
To take care to support some of the children to be able to finish school and all that. These are real stories, and that is why what we're doing today is important, because they will touch a lot of lives and help a lot of our fellow citizens.
What's up guys? My name is James Gardner. Make sure you check out In My Lane TV for everything entertainment. Respect.
As you can see, this is Mahama Cares, the medical training and stimulation center that Mahama just launched today. As you can see, so this is Mahama Cares. This is the medical training and stimulation center that Mahama just built, the hospital Mahama have just launched. So as you can see, the environment. So you are live on My Lane TV. So keep on watching My Lane TV, bring you all updates here.
Right. You get a video for I get that. Take pictures.
Michia President Mahama, any nature different any penny for you now more. Damasi Sham. I don't find so. I am a lady, and the man who was a Miss Mijinaha. We are diabetic patients. And maybe brave Tremun. Yahoo say a penny for Yari. And I know music, only stretchy, and only as I am. But Minnie said, Adia Yaria, I bet my back, Golamusu. Ninya no I check a cry. Ba me protecting me kakra say me sumet na se I check a cry. Yare body pa. Ekum e ma we kura. But na me adum e go sumit na se. Nti dia me kan say sesia no e bia ba me ban so. Me gusu a me solve. But enya yare a e be pop. You better take care of. Until the Betty Banny said, now, and boy, now, into me soon. But I did a grand mechanic say, yeah, Bruno, I am a body. Me, I'm meeting a man, me a single parent. I won't polite dream. Me to be chefy. Now I do, Nakasamato, Namatama Colanaso. I had the mammy, at times the baby cry, Yammy Lebem. See, me, I just read in say, I best say, my penny, and young one my a drone, na yɛntimi nya do na yɛmfa keke yare wei ɛfi yɛn so do sɛ ɛnkɔ but yɛbɛ prevent ma deɛ a ɔnni bi no ɔno nso bɛnya aduro no bi ɛde a preventing no ɛda n'ase sɛ Mahama Cares na ɔde ba yɛn no ɛda n'ase bebree sɛ nyame nhyira so na adwempa a ɔyɛ ama yɛn sɛ ɔfa bi ɛwɔ mu ma yɛn no ɛmpere mu ɛda mo ase.
Story of Janet Ashibu. The daughter is also here, but for obvious reasons.
Your Excellency, the President of the Republic of Ghana, John Mahama, Honorable Minister, heads of agencies and directors, members of parliament, distinguished guests, I'm standing on existing protocols. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners, who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, unhealthy diets and physical inactivity. Furthermore, there is a lot of evidence that support the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health Development Partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
Thank you, Manuel DeWeese. Of course, if you mention MTN, you must mention Telecel.
To take care to support some of the children to be able to finish school and all that. These are real stories, and that is why what we're doing today is important, because they will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch, because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents and your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from Calbank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming to help are your clients who save their money in your banks. There are clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you're giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prophet Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made. And we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical sectors. And so when he gave the envelope, for a retired pensioned, medical professional, I was curious to see how much he had given. And so after I took the check, I gave it to the health minister. After a while, I collected the envelope back and I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. Doctor on pension has given $1,000. And so that should encourage all of us and encourage the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama. So thank you very much. Now let me inflict my speech on you. Mercifully it's short, so you won't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets.
Let's do this orderly, please, and stand by for the national anthem right after this. It's over now. Stand by for the national anthem, please. Remain standing now. We'll take the national anthem, please.
Thank you all very much.
Charlie, who blocked the other guys? Go back.
I'll be in touch. Okay, take care.
Come on,